Hello, I'm Councilwoman Pastor, and we are here today to talk about COVID-19. I am sitting with Dr. Shukla and Dr. Prichard, and as you can see, we are social distancing, 6 feet apart. I wanted to bring you together to talk about COVID-19. As we can see, the cases are rising. First of all, last week we made an ordinance of wearing masks, that everybody in Phoenix needed to wear masks. What is the importance of masks?
So masks can help prevent contamination from somebody who has COVID to somebody who doesn't. A lot of things can contaminate people, sneezing for one thing, but also just merely speaking. When you speak, I don't know if you notice that some people spit a little bit when they speak, and the virus that can be in the oral secretions can actually contaminate another individual. So it's an important way to limit exposure to other people. And it can protect you as well from exposure.
So, as I was speaking earlier this weekend, somebody had questioned me about wearing the mask and why I was wearing the mask, and I had just said to protect myself and to protect you from the droplets. And neither one of us know if we're infected, and so that's one way of protecting us. The second item is that testing, as our numbers are going up, can you explain about the antibody testing? Because people there's certain people don't know what to do. Especially if when they say, I want to go take a test, they don't know what type of test they need to take. So could you please explain, Dr. Shukla, the antibody test?
Right, so there's 2 antibody tests. There's one known as the IgM antibody, and the other is the IgG antibody. So the IgM antibody is kind of looking at acute infection, so people who've been recently infected and within 7 to 14 days, at that point they're still infectious. And then the the IgG antibody is the immunity antibody, and that usually develops 3 weeks or so after your last symptoms. And that, we don't know how long that lasts, but you have immunity for a period of time to the COVID-19 infection.
So I know people are going to go back to work. As we have opened up, some people are wanting to go dine out. What do you recommend for them to do?
Well, certainly, all of the practices that we've been talking about, social distancing is important. Wearing the mask when you're out in public, obviously that's an ordinance now, as well as frequent washing of the hands, not touching the face, not touching the mouth are very important. Not touching your mask, kind of doing your mask all the time, because you think about, if you are wearing a mask and you were near somebody who has COVID and they do cough or spit, then that could be on the outside of the mask. You're constantly touching your mask, you could have it on your hands too. So important for frequent washing your hands and then not constantly adjusting your mask. It's a hard thing to do, easy to say, but try to concentrate on that. Another thing that might be helpful is because we're wearing a mask all the time now, we can get rashes and kind of what we call maskne, mask acne on our faces. So wearing maybe having a couple different style of masks that hit our faces in different places so that we're not constantly in the same place, and then frequent washing of our masks, especially if they're cloth masks like the one that you have that's washable, continuously washing that mask so that it's not the oils of our skin constantly in contamination with our skin.
I have another question for you. Do you recommend that companies or cities continue to test their employees as they're entering back into the workplace? Because with the rise, we know that we're getting more and more exposed to people coming into work that have COVID, and then we all end up getting tested. And my question is, okay, we've gone through this period of staying home 7 days, 14 days, should you take another test?
Right, there's this whole concept of this asymptomatic carrier, right? And so if you have the IgM and you've been exposed, you're still potentially can infect somebody. And so what we're doing and what we're recommending is routine testing every 7 to 10 days for people who are IgM, who test positive for IgM. Once you test positive for IgG, you can be tested 6 weeks, 3 months, because you're immune. But the people who are known asymptomatic carriers and have tested positive for COVID and don't have symptoms or have tested positive for IgM, they should be tested frequently.
Also, if you're testing negative for everything, remember that this is just a slice in time. So at one point in time you might be negative, but that doesn't mean next week you're going to be negative, because nobody has perfect quarantine. Nobody wants to, either. So doesn't matter how careful you are, doesn't matter how conscientious you are, you still have some exposure. That's a possibility. So routine testing, even if you're negative, is a good idea as well.
Especially if you're in the public.
Yes.
So earlier we did the firefighters, and now they want to be tested again as exposure rates are going up.
So it's a constant, we constantly will have to be tested. It's just going to be part of our daily life until we get a vaccine.
Yes.
So could you please explain to me what the antibody testing is all about?
Sure, absolutely. So this is known as a serological test. So it tests antibodies in our plasma versus the molecular test where they put that swab down your nose into your nasopharynx, and that's a molecular test where they're looking for actual virus particles. The sensitivity, unfortunately, of the molecular test is low because of the fact it's hard to get a good sample. So because of that, the sensitivities range from 60 to 70% sensitive. Because it's easier to get a plasma sample of your blood, the sensitivity of this test is much higher, kind of 95%, with a specificity of 99 point something percent. So what's done is a sample of blood is taken either from the finger or venous puncture. It's put into a buffer solution, and every test is different. This happens to be the Array biologic test. And then drops of that mixture of the plasma and the buffer are then placed on these test strips. There's a control band that shows whether that test is valid. And if that test is valid, we look for a band at the T line or the test line to show if they're positive for IgM or IgG, or if they're negative for both.
Well, thank you.
And this is a great thing to do for when you need to test people for the masses. It's very simple. You get your results in 10 minutes. It's very, very easy.
Yes, versus a molecular test on the nose, it's multiple days of waiting, plus it's a much harder test to perform, much worse on the patient. And this is better for asymptomatic screening versus symptomatic screening.
And it's easier for companies, too,
Absolutely.
to be able then to do mass testing of employees.
Right.
Really appreciate your knowledge, everything that you do for the community. Thank you. I want to thank everybody. I'm Councilwoman Laura Pastor in the heart of the city, Rockin' District 4.